I was told by Ivan, a dog trainer that is really against using SSRIs like Prozac, that one of the reasons he doesn't like it is because of his experience and the fact that in people, SSRIs can cause emotional blunting. Now, to be honest, I don't really know that much about those SSRIs or any behavioral medication in people because I'm a veterinary behavior specialist and not a human psychiatrist. Now, although we do use a lot of the human knowledge that we have and kind of like transfer it or translate it into animals, it's not always exactly the same. And because I do admit I don't know anything, especially about things that are not actually in my field, I went and asked a psychiatrist about it, a human psychiatrist about it, and he said, yeah, that's actually a common side effect in humans. It's actually true that some people will have emotional blunting as a side effect of the medication. Now, this is important. Why am I saying that it's a side effect? Because there's a big difference between giving this medication to actually address the problem, address anxiety, address other behavioral issues, and then accidentally causing emotional blunting, and then the person is not anxious anymore, but kind of like maybe not feeling anything anymore. And of course, that's not the goal of the medication. Yes, it might help with the bad stuff, but it's also creating new bad stuff because now the person is not feeling joy or happiness. But I asked that psychiatrist, so what do you do if that happens? And he said, we change the medication or we try to find other ways to address the problem. So again, really important. The emotional blunting is considered a side effect. Technically, if someone has that side effect, something needs to change. Now, what Ivan, that dog trainer that I mentioned, said was that his experience treating other dogs that were on this medication, and I think even his own dog that used to be on this medication, it did seem like they were experiencing emotional blunting. They weren't happy, they weren't energetic, they didn't really want to do that much. Now, do we know if dogs have emotional blunting? No, the answer is we do not know that. Is it possible? I guess so. Again, many of the things we see in people can also happen in dogs. The brain does work in very similar ways. We don't know if dogs can have those complex emotions like people do, but let's say that they do. Let's say that they do experience the same nuances that we might experience, our brain might experience, and they can actually also get to that emotional blunting. So how do we actually know if they are or aren't? Well, by observing them. Sadly, we can't just ask them. So we observe and we decide how they behave. And that's important because that's exactly what Ivan did. He saw those dogs and he assumed that because they behaved in a certain way, it meant that they're experiencing emotional blunting. But where's the problem here? The problem was that when he was discussing all kinds of studies that were done on dogs on different SSRIs, he said that most of those studies were surveys asking owners about their dog's behavior. And he said that surveys are not a good way to actually decide if the dog is actually experiencing side effects or not. And while I do agree that it's not the best way to get information, I wish we could do studies where we actually give the dog the medication and observe how they do in a year, in 2 years, and of course, a shorter time. In most cases, we can't do it. Technically, we can't do it because it takes a long time and it takes a lot of money that in our field is just not really available. But that doesn't mean that asking the owners and asking the right questions is not a good way to get to the bottom of it, to know how the dog is behaving and how the dog is responding to the medication. That's actually how we know that a dog has side effects. That's also a very big part of my job as a veterinary behavior specialist. I just ask the right questions. I know what to ask, and I ask the right questions in order to know how the dog is actually behaving and know if there is a problematic behavior, or is it a normal behavior that's just unwanted by the owners? And according to the studies that we have, it doesn't seem like SSRIs are causing a lot of this emotional blunting. They might, but again, it doesn't seem like it's that big of a problem like it is in people. And how do we know? So basically the same way that Ivan knows. If we see that the dog is all of a sudden not as active as he was before, if the dog is not playful anymore and he was before that, if the dog is not responding to good stimuli like he was before, and of course, if the dog kind of like seems like a zombie, these are ways that we can tell if a dog has something that might be an emotional blunting. And if we do see something like that, we do regard it as a side effect. And if that's the case, we actually want to wean them off the medication or change something to get rid of the bad behavior, but preserve the good behaviors. And by the way, there are different families of medications. There are SSRIs, which are the serotonin selective reuptake inhibitors. There are the TCA, the tricyclic antidepressants, and there are SNRIs, and basically many other groups of different medications. So I know that usually Ivan doesn't like SSRIs, but I'm wondering if he would be fine with trying other families of medications. And by the way, if a dog responds in a negative way to one SSRI, it doesn't mean that they're going to respond exactly the same to a different SSRI. Even though they're from the same family, the response to them can be very different. And the last thing I wanted to say in this video was that it was brought up in one of his podcasts. It was an interview with a human psychiatrist that also, well, his job, he makes money by getting people off medication. So of course he's going to be against using medications, or is at least going to be telling people not to use medications because that's how he makes his money. And I'm not even going to go into the fact that he started talking about dogs while he doesn't have any knowledge about dog behavior. Kind of like if I would have started giving psychiatry advice on podcasts for human behavior issues, well, that's not my lane, that's not my field. But in that podcast, the psychiatrist said that we don't actually know, or we might even think, at least according to some studies, that those SSRIs are not actually bringing the serotonin level to something higher because the person with the behavioral issues had less serotonin than other people did. We don't really know how many of these drugs work, and one of the theories was that people with low serotonin, and by the way, it was shown in some studies, but that people with low serotonin get better because with the medications, we increase the serotonin. But according to other studies, which you brought up on the podcast, it seems like the theory doesn't always carry water. It seems like many people with depression, they couldn't really find that they had lower serotonin than other people, normal people had. Normal people. Again, it's not necessarily that everyone that's taking an anti-anxiety medication is normal. That's a spectrum. Or I should say abnormal versus normal. Again, there's a spectrum. We don't all behave the same. We don't all feel the same. He said that if it's not actually the effect of increasing the serotonin, which helps those people, but something else there, and we don't really know what that something else is. And he said that that's a problem because we're not actually fixing the problem, we're just masking it. And again, I'm not talking about blunting, because blunting, we're not fixing anything because now the person is not feeling anything, kind of. And you know what? In a way, I agree. Many times using the medications is not gonna fix the problem. Now, I'm not gonna delve into the human medicine, into psychiatry, but I can tell you what we, veterinary behaviorists, do, how we actually use those medications. Because none of us actually think that just giving medication is gonna help. We treat those medications as a part of the treatment. Sometimes a big part, but just a part of the treatment. The medications are there usually to help us address the actual problem. So, for example, we'll give the medications hoping to reduce the anxiety, but then we'll also teach the dog all kinds of ways to deal with the anxiety or with whatever triggers the anxiety or the fear or the aggression. If it was that easy that you can just throw random medications on a dog and then everything is going to go away, then I wouldn't have a job. Any veterinarian will be able to just prescribe a medication and that's it. But we always say there are no magic drugs. So technically, and many times we even try to wean the dog off the medication after he learned the new behaviors. We'll only keep them on the medications, on the SSRIs or any behavioral medication, if we see that they can't really function without those medications. But still, we're not going to stop with the behavioral modification and with the environmental management. So technically, even if there's some emotional blunting, and again, I'm saying some, because if we notice, or the owners notice that something is not right with the dog, then of course, we're not going to continue with that treatment. But even if there's a little bit of blunting, even for some of the good behaviors, if it helps us address the actual problematic behavior, then I do think it's worth doing, again, if there's no other alternatives that don't require us to use medications. A comment that I get a lot on my videos when I review trainers that use things like shock collars or prong collars and stuff like that is that if the trainer or the owner wasn't using that prong or wasn't using that shock collar that hurts the dog, then the dog will be surrendered or will be euthanized. Now, if you agree with that claim, then why are you so much against using anti-anxiety medications? I can say the same thing. Many of those dogs, if they weren't on anti-anxiety meds and behavioral medications, their owners would have surrendered them or euthanized them. And then you need to think, what's worse? Hurting your dog with a prong collar or shocking him or making him more fearful and not being able to actually show the problem and show his real emotions, or giving him medications that might actually also suppress some emotions according to this claim. I think that it's a bit hypocritical of trainers to say, yes, it's okay to suppress emotions by using aversive methods, but it's not okay to suppress emotions, which is not really the case, by using anti-anxiety medications. What do you think? Did I convince you? Did I teach you something that you didn't know? Please write down in the comments below, and please like and subscribe. It really helps the channel grow and hopefully get this information go to more people. Now, if my really bad hair day didn't affect you that much, then feel free to watch this video next. I promise that in that video my hair looks a little bit better.